just creating simplicity in this communication between the provider and the patient opens up not only a helpful tool for the provider, but it also takes all the pressure off the patient. It's the same as when you take your car into the auto mechanic and it's been clicking all week. And then all of a sudden you get into the mechanic and all of a sudden I can't make it happen, right? Patients bring that same pressure in with them to the provider. So they're saying, well, I know it got a little better, but then I also felt more pain the day after and I can't remember exactly the details. If we just give them a simple way to communicate on a daily basis, then all of a sudden that pressure's gone.
Tom, good to see you again.
How are you?
Quick conversations with some of the exhibitors here at the AOMT conference. Sarah Health. We've talked about this on our podcast, but I wanted to make sure people understood the big three questions. What do you do?
Yep.
How does it make someone's life better, or how does it make their organization better? And then the close, which is what do they need to do to get it? So if you were to describe, like, what does Sarah Health do, or what do you seek to accomplish? What is it?
So we are a RTM platform that essentially just simplifies engagement with patients between visits. So as long as you've got an active care plan, then we can send out automated daily text messages to those patients, and that helps them give helpful feedback back to their provider so that they don't feel lost in the care plan.
Yeah.
You know, it's so often that we hear that a patient will get started and they're, full go, right? And then all of a sudden they just drop off, or there's a barrier between what they're trying to do, the homework that they've got to do. It got hard, right? So now they all of a sudden have not done what they needed to do on their end, and now we're kind of just trying to drag everything out of every visit. Mm-hmm. This gives them the ability to have this little daily accountability bite where now they can remember that, okay, this is a process. We can remind them, here's where you started, here's where you're going. So it's just an engagement tool that allows patients to communicate effectively with their provider, and we do all of that via SMS text.
All right, let's go backwards before we go forwards. Okay. I'm going to explain what I think it is, and then you're going to correct me. All right, so RTM, Remote Therapeutic Monitoring, is a way for clinics to stay connected to patients and get paid for it. We'll call it reimbursed in our profession, right? But
that's right.
We get paid for it. And the way that it becomes, billable is you have to have these 16 instances per month, because most months are about 30 days. So 16 is just anything over 50%. So they call it 16 instances. And it's the grout between the tiles, right?
Oh, I like that.
We know the magic is great when we see our patients and there's engagement there, there's eye contact, body language, and then there's this space between visits or between contacts, and this allows a clinician to maintain contact, but simply.
Yeah.
Right? And not necessarily synchronously, asynchronously, right? Okay, that's a big one.
Correct. So it's all asynchronous communication to get the engagement that you're talking about, the 16 engagements in 30 days. But there's also a synchronous component as well, where patients are always going to call the clinic. They're always, I get clinicians that tell me all the time that, a patient will show up in their lobby and they will just wait until they've got 5 minutes of free time because they've got a question, right? So this is a real thing that providers are dealing with. And there's no mechanism, or there was not a mechanism for them to get paid for that.
No clean mechanism.
That's right.
Right. Everything's a little gray in that area.
So RTM codes were released to help with that, help get providers paid for the work that they're doing between visits and help patients complete care plans. And we essentially just simplify that process so that you don't have to track anything, so that you don't have to figure out how many engagements everybody has. That's our job.
When I first heard about RTM, and I think I did my first episode last year, so we're talking about 12 months ago. Yeah. That was the first thing that popped up. Is in my head, I try to play the role of the audience, which is clinicians are going, one more thing for me to do? Yeah. One more thing for me to track?
Yep.
I don't have enough Post-it notes to keep track of all those things. And then how do I prove it? And dude, it's not worth it.
Right.
Clearly Sarah Health saw that and said, we're going to manage that for you. And then in terms of benefit, what are you seeing? What are the actual codes? All right, I know it's dirty words in our profession, but what is this worth?
Yes.
And this is the cool part. The codes are there because the value on the payer side, they're saying, we understand, you're valuable. Yeah. We're just asking you to show it. So if per patient per month, ballpark it, what could a clinic add to their bottom line?
Let's talk per episode.
Got it.
Because I think that's an easier conversation. Sure. We're going to see a $60 increase in revenue per episode of care is going to be that baseline. There's
patient.
more on top of that
Right.
if you're going to set up additional phone calls and workflows. But we like to structure this in a way where we know the parts that we can control. Anything that we can automate and take off of the provider's plate, that's what we're going to build into, here's your expected outcome. There's more that we can do with better workflows and with setting up a mission control PT that's going to be the triage agent for we can do all of that. But I would rather talk in the lens of, here's what I know that I can actually affect and control, and that's going to be that $60 of increased revenue per episode.
Per episode per patient.
Correct.
So you do math pretty quick if you can count by sixes. If you're saying this would sound great to 80% of my caseload, that's 80% times 60.
Yes.
I also imagine there's some things that would be downstream, which would be that patient who is still engaged is more likely to refer you to their family and friends because they got better, they're more likely to come back again, things like that.
The coolest part about this is that the channel of communication that we create when you add a patient and we're sending those daily texts, that does not close when the patient is discharged. So we're seeing that clinics that add Sarah are seeing higher re-engagement post-discharge because 6 months down the line, Mrs. Smith rolls her ankle playing pickleball. She has the best relationship with her PT than anyone else in her care plan. So who does she want to text? That PT. And so then that allows her to have the simplest form of communication. I mean, I say it all the time. We've been trying to educate the population on direct access for a long time.
Right.
Turns out maybe we just needed to send them a text.
Yeah. Well said.
Yeah. So just creating simplicity in this communication between the provider and the patient opens up not only a helpful tool for the provider, but it also takes all the pressure off the patient.
Right.
Patients, it's the same as when you take your car in to the auto mechanic and it's been clicking all week. Right. And then all of a sudden you get in the mechanic and all of a sudden I can't make it happen, right? Patients bring that same pressure in with them to the provider. So they're saying, well, I know it got a little better, but then I also felt more pain the day after and I can't remember exactly the details. If we just give them a simple way to communicate on a daily basis, then all of a sudden that pressure's gone.
Yeah.
And you can actually get to work with that patient instead of wondering, all right, I haven't seen you in a week.
Yeah.
So let's see how you've been doing. And then you're forced to ask so many questions and qualifying questions just to get valuable information.
And it's too late. It's 3-4 days away.
That's right.
The last thing I'll throw in that I heard you say was you said my PT when you're texting my PT versus I'm going to see the PT. We've been trying to say that for years since I've been PT school. It's like, how do we have like ownership? I've got my dentist and my doctor. It's like my PT, and I can reach out in a trackable, easy, smooth way. It sounds like you guys have solved that. Yeah,
we actually even recommend that when we add a patient, or when you add a patient, that when they save that number in their phone, save it as My Amazing PT.
Right.
Save it as something that's creative where they know that they're going to be texting their PT.
Yeah.
And that changes the way that interaction goes. Now all of a sudden it's personalized.
Yeah.
And the more that we can personalize care, the better the outcome's going to be. And it's easier for you to ask the patient to do anything at home and to have an expectation of them completing it. If they know that you're keeping tabs on them and that you actually care about them between the visit, it forces action on their part, and that really helps them complete that care plan.
Where's someone going to go to get more information and contact Sarah Health?
SarahHealth.com, easiest place to go. And there's book a demo links all over the place. We'd love to show it to you.
Perfect. Tom, thanks for coming out.
Hey, thanks for talking.
Appreciate it.